You're watching News at Prime. Let's get into this discussion now. The Gauteng Health Department says it's hard at work to ensure the smooth rollout of the National Health Insurance. Officials have announced that Mamelodi Regional Hospital will be the first NHI-ready public facility in the province. The Gauteng Health MEC is Nomantu Nkomo-Ralehoko, who joins us now for more. MEC, good evening to you, and thank you very much for your time. Let's start with what appears to be some good news, and that is the audit outcomes. Talk to us exactly what the Auditor General has said about your finances in the province, and then we'll move a step further from then on.
Good evening, Cleli, and good evening to the viewers at home. You know, it is good news indeed, Cleli, because for me, when I arrived in the department, you all know that the state of the finances were were in a bad shape, if I can put it that way. And it was clear that we needed to work hard to fix things. And part of those things, in fact, Premier, when he sent me to the department, he said I must make sure that I prioritize the finances of the department, because we had a big debt that we were having. We couldn't pay our suppliers on time, and we were facing many legal claims that we had to pay. And the department was really overwhelmed, and we needed to come up with quick solutions. I had to have an agent meeting with HE, which is Auditor General, and a meeting with Treasury. We formed a team that must assist us, that must meet on a weekly basis to ensure that we look into all those accounts that we have, the suppliers that were unable to pay for years, and we had to have make arrangements so that we're able to deal with those processes. So in fact, we even went further, because some in the hospitals, they were unable to pay some of the medical suppliers that were supplying us in the hospitals. So we had to deal with those. And I can proudly say now we have improved. We have improved our finances. We have improved in terms of payment of suppliers, although we're not still at 100% as it is expected that we must pay them within 30 days. But we are not, it's unlike now, we are no longer like we used to do before, not even paying them. We're no longer running away now from them. We sit down with anyone that we owe and clarify that person. So things are shaping up, including part of the area that has been one of the sensitive areas in the department, which is the litigation or in the department. We were litigated in quite a number of areas. Our litigation cases were dating back as far as 2003. And we said, let's look into all those cases. Let's meet with the lawyers, but let's mediate, because now we're not mediating in some of the cases. Then we set up a team of lawyers that was responsible now for mediation, which is running there. It's not a number of people. It's just about 3 lawyers that were to bring them on board. They're advocates. They are sitting in every case before we can even go to the state attorney and make their cases and argue our cases. But in most cases now, we're even sitting with the people that were supposed to help, who are litigating us. And I'm sure that's why, if you can follow up now, we've reduced even our bill when it comes to litigation. You can't believe it. When I arrived there, we're sitting at 30 billion contingent liabilities. Although contingent liabilities doesn't mean that you are going to pay that amount of money, but already it was their estimates that we will be able to pay them. We've moved now. AG always audit us, because that's another thing that has helped us. Yeah. AG audit us and check how far are you. Now we're sitting at 13.5 billion as the latest developments on the audit that they've done. But not all is lost, because they are still continuing with mediation, the colleagues that are there on the finances. So I think we are relaxed a bit on something that was really frustrating us. And as a department, we're able now to work. And now we have made it a point that in the last few months, because I'm counting months now, because I think I'm 23 months, 6th administration and the 7th administration, I'm 23 months there. We have been able to show progress in solving even other problems that we're experiencing. Even the staff attitude that was there in some of our hospitals and our clinics, it was done because of the manner and the pressure that they were working under. And now we're running the hospital smoothly. Staff is helping patients. We have campaigns of I Serve with a Smile. We have a campaign that is called hashtag Asibe Healthy GP that we have launched every Wednesday, where we have Wellness Wednesdays that we are doing. We're focusing again in dealing with the negatives, slowly, that department has been having, because that department has been surrounded by negativity, and we're trying to improve as much as we can.
Well, talking about the negatives, MEC, eventually we were going to get to those, because returning millions back to National Treasury when the healthcare facilities, public healthcare facilities, are in a state of disrepair in some areas, particularly what we've seen from patients who post these on social media. That can't be good news. Why were monies returned to National Treasury?
On infrastructure, we had the infrastructure grant. Besides that, we have the infrastructure that we get from the province, which is the allocation that we're supposed to use. Then on the infrastructure grant, that's where part of the money was returned back. I remember because it's the time that I arrived. And I think we used it up to 97% because we used percentages. So 97% was used, but the other percent was we didn't use the remaining. But we agreed with the department then that let's always now make sure that when we operate, we work very closely with the DID, because remember the infrastructure, there is a department that is our agents, which is the Department of Infrastructure that is dealing with those issues. But in most cases where the money was returned, it's when we delayed maybe about the building plans, because one of those areas is the area of LINAC machines that were supposed to be built at Dr. George Mukari and at Chris Hani Baragwanath Hospital. That money was not used, but we didn't even return it back. It was rolled over because they knew that we were waiting for the plans from the municipality. I personally, because I know that once we had that, this is the issue, I personally called the MMC, both from Tshwane and Johannesburg, telling them the critical area that we need to make sure that we service, which is related to cancer, because those LINAC machines are the machines that, if you remember, the Cancer Alliance was crying about, which was the reality, that we can't build them without the proper plans that must be done in those hospitals. So those MMCs helped us immediately when I made those meetings with them, but they intervened, we managed to get the plans. Hence now we're able to build. So we did that money was not returned back. So it was rolled over, because in finance, what you do, you go and argue and make your story, tell them why are you unable to utilize this money, because it's allocated for this. So we did exactly that. Good thing it was that I'm coming from finance. I was an MEC for finance. So I know that the only thing that the MEC of health, who is myself now, must do is to put up a plan, go and explain what are the reasons and when are we going to do that project. So they understood, and then they kept that money for us. So it was easily rolled over. Hence now we're building, because the minute those plans came, they were able to give me the go ahead to start building. That was the issue. So in the last financial year, I didn't return any money on the infrastructure, because I knew now that we must build. Even you remember, if you have seen Bethakwa, the old Bethakwa, we've renovated it now as a mental health hospital. We've built wards at Begimlangen for mental health, acute mental health ward, at Baragwanath, at Kopanong. I can count all the hospitals that we have done that, Dr. George Mukari, almost all the hospitals, 37 hospitals now. We have acute mental health wards that we've built with the money that we get for infrastructure, in particular the grant that can be shifted to do anything else except to focus on those. Then on maintenance, which is the money that we get from the province, we've made it a point that we work very closely now with DID. We monitor them. Any project that is there now, we always say, let's operate. I always say to them, because that's me that says that in the meeting, it must be a project cycle. This is the project. Have a cycle of a project. After a week or after 2 weeks, if you are not finishing, go and check what is it that you have not done in your project. Hence, we're able now even to improve our infrastructure in the hospitals.
Yeah.
I'm sure you have seen some of the renovations that we have done. It's because of the hands-on approach that we've decided to do, not only let everything done by DID, work very closely with the officials from the DID. And I think it's bearing results. There are good results now that we're getting, because out of all the projects that we have not been doing in the province, I can tell you now only 5 projects that have been there for years that we couldn't complete them, that we're completing them. In other specific areas, we are doing that, including the ones that we have not been speaking about, like in Kopanong, we have not been there. Or in Kopanong, we've finished quite a number of areas now, renovated a number of places, besides that old structure that was not done, which we have plans even on them now, that we have architectural designs that have been done, that we are able to do that.
Okay.
So, yes.
All right. Okay, can I ask you to just pause there for a moment? I'd like for us to have a conversation, as opposed to you almost giving me all of the rundown of what you say are successes in some areas, but also challenges in others. Very quickly, on the financial front, the MEC of Finance says that there is a financial crunch, and your department is among those that are likely affected, particularly yourselves and the education sector. So it becomes important for you to look after your finances. Now, it was your reply not too long ago to Jack Bloom of the Democratic Alliance when you disclosed, this was a written reply, you disclosed to Jack Bloom that 3.9 million rand was paid to 7 Cuban doctors who had left South Africa to go back to their home country, Cuba. And it was for a whole year that these doctors were actually paid by our country when they were not even here. They were brought on the basis of them to try and help with the COVID-19 pandemic. That is money gone to waste, MEC, is it not?
It's not, because remember, when they were here, they were working. And unfortunately, because of our processes, there were monies that were not paid to them during that process that they were working. Because eGov, I think is because the process is done by the Department of eGovernment in terms of processing that the salaries of all government departments. So that money, they had to be paid then, even if they are no longer there, because it's the money that we owed to them. It was unlike they didn't do anything at all. But because they were working, they never even complained that we're not getting paid. There is a process of finalizing our documents and whatever things that needed to be done by them and signing at eGov, which was done a bit late. That was the reason, not because there was a wasteful expenditure that was done to them. That was the reason.
It can't be, MEC, because in this instance, it would appear that you are now changing your statement, because your reply in the legislature was that officials involved in this have been charged and disciplinary processes have commenced. The department referred the matter to the state attorney to assist with recovering the outstanding balance. So how can that be?
No, clearly, that money, remember, that's why I was saying officials that were involved must be charged, because there was a delay that was done by them. The charges go to that part of that. If there's any money then after that process, because now there are verifications that must be done again. If there's any money that has been misused in the process or overpaid or whatever, there will definitely be consequences. They will have to bring back the money. So, but I wouldn't lie to Jack and say it's not right. It's not black or it's white. Clearly, somebody was involved. That's why I was saying between my department and the Department of eGovernment, somebody was at fault there, because that shouldn't have happened if immediately their documents were done on time, everything was done properly. So there were some procedural flaws that were done. That is why whoever was involved, they must account and clarify why they didn't do it. And if there was a mistake in terms of the counting, it will definitely be done. They will be dealt with, and the money will be recovered because that's a state money.
Okay, all right. I'm glad we are now on the same page. Let's move on then and talk about the processes toward the implementation of the National Health Insurance. Do you agree with me that for the NHI to be effectively implemented, we're going to have to start with the primary health care, and it's got to be quality primary health care? That then, I think, takes us to the Tembisa Regional Hospital, which we are told is the first NHI-ready health facility. What does that look like when you think of quality primary health care? Mamelodi Regional Hospital. I'm sorry.
Yeah, I agree with you. Mamelodi is the best hospital. We were there even on Friday opening some other wards that are up to the level that you will expect. But what we have done again, all the other district and regional hospitals, including academic hospitals, any renovation now that we're doing, we are benchmarking with Mamelodi. Even if you want to do just your mere ward, a small ward for babies, which is neonatal ward, we want you to benchmark there because that's the best hospital that competes, even beat some of the private hospitals that we have in the province. And we've done that trend. You can go, you'll think that because I'm not far from Petaklo, I'm 5 kilometers away from Petaklo. You can go to Petaklo as we speak now. You will see that it's exactly at the level of Mamelodi. You can go to Far East Hospital, it's at that level. You can go to Pulusong, it's at that level. Kopanong, it's following tune. Smokeng, we're trying, but it's very difficult for Smokeng because of the number of people that are going there. But there are specific wards that we're doing. You can go to Pegimlangen Hospital, it's already following exactly the same level of Mamelodi. In fact, we have assigned a doctor who's Dr. Snabe, that his job is just solely to go and check if we're compliant for NHI on daily basis. Every Monday, I get my reports. Who is not doing that? Who is not compliant in terms of OHS now? What are the issues? What must we do? Besides that, then Charlotte Makleke, Christiani Paraguanath, one of your biggest hospitals, which is the size of 3 hospitals, it's now competent. She is at that level, to including some of the wards that we've already renovated, that we're opening up. Get into the equipment inside those hospitals, clearly, we have the best equipment in all the hospitals. And I always say how I wish South Africans can see. But I know that we have a date with all the editors soon and some of the journalists to go to hospitals with their cameras. This time they are not going to sneak when they get into the hospitals. I will be there saying to them, just get in, do whatever you want to do, because I want them, when they're inside there, to tell us what are the other things that they think that they are not doing right. Yeah. People tend to forget that we need this oversight equally from yourselves, because you are the people that must help us to do things right. And when we are not doing that, you are not helping us. For me, I always say journalists are helping me. It's not an attack for me when you are raising something that I'm not doing right. Yeah. Remember things that were raised about Tembisa. And if we can go now to Tembisa, immediately when I arrived on the 22nd of October, the first danger I was hit by the issues in Tembisa. And I was in Tembisa, and immediately we changed all those wrong things, including the accident and emergency area. That was the worst one I've ever seen. But now, because it was the journalists that picked it up then, including the menu in our hospitals, we've changed the menus now in our hospitals, and we've even signed a memorandum of agreement with universities and technical colleges. We are getting students now that are cooking in our hospitals, working with aunties that we have employed there to make sure that our hospitals, our patients get the best quality food they need. You can go to Carltonville, as far as Carltonville. That's one of the best hospitals now that we've renovated that qualifies for NHI. So I'm just highlighting that with joy, that sometimes you may think that it's painful, but it's a pain that helps us at the end to do things correctly as government.
You can have a state-of-the-art facility, MEC. But if the staff working there do not present the service that patients expect and present that with a smile, and talking about a smile, you are running what is called I Serve with a Smile campaign. I'd like for you to just think about that for a moment while I take a break, because we're going to conclude the conversation around these state-of-the-art facilities you're talking about, but they mean nothing if the people working in them have a stinking attitude. We'll continue after the break. You're watching News at Prime. If you're just joining us, we are concluding a conversation with the MEC of Health in Gauteng. The MEC is Nomantu Nkomo-Ralehoko. MEC, again, I don't want to complicate these questions. So for us to get to NHI, remember the theme, it's to get primary health care correct. And so, again, we're dealing with progress towards getting that primary health care right. And so if indeed there is progress being made towards getting primary health care correct, do you agree with me that the Tom London video would not have surfaced talking about the quality of service that he was receiving, or perhaps the lack thereof, at the Helen Joseph Hospital? You are running that campaign which says, I serve with a smile. Do you think there is progress? Because I argue that there is no progress. Otherwise, we would not have had a Tom London talking in that way. And I probably suspect that there are many other Tom Londons out there.
I will not dispute that, Koli, when you said that, but I still believe that there is some impact on our side. Because when I arrived in the department, we used to have more complaints than compliments. So that's what I've been assessing every Monday in our Monday meetings, that how many people have complained in every hospital, because we have quality assurance managers in every hospital. That's why I'm sure you've heard about other people saying, I always say to people, can we operate like a bank? So that when a person arrives at the door, how can I help you? Like what they do, especially in my bank, where I bank, which is FNB. Once you get there, you feel comfortable that somebody is going to help me. That's why I felt that let me come up with a campaign of a Serve with a Smile and Care campaign, because people will feel at home. It's just to simplify the Batupili principles about that campaign. It's not something that is different from what public servants are supposed to be doing. And they are doing it in some cases. Well, we've rolled it out to all the hospitals. We've rolled it out to all the clinics. I have been leading as a leader of I Serve with a Smile and Care campaign, because for me, it's just the basics again. Where do you come from? How you grow up? You were taught that when you see an elder, even if it's a person that you don't know, you must greet that person. You must treat that person with care. So that's why I even say that campaign must not only focus on the nurses, which I think people thought it's only focusing on the nurses. It must start from the security guard at the gate to the receptionist. You move it to the administrator that is going to give you your record. You take it to the theater if you're going to the theater, with the porter that takes you there to the theater, the doctor and the nurse that are treating you. So it must not only be for specific individuals. And here at Helen Joseph, the young doctors that come, because if you can speak to Tom, as I've been communicating with him, Tom's problem was, he was saying to me, MEC, the only problem that I had, Dr. Pillay and the other doctors, he was calling all the other doctors that have been working with him, they never gave me the attitude that I saw this other young doctor is presenting. At the hospitals, every 6 months, we have new doctors that come in, coming from the universities. So we were not inducting them to I Serve with a Smile campaign when they get into the hospital. But now I've had a session with the VC, Utatu Vilakazi, Uzeplom, and he agrees with me that anyone now that will come to the institution, we will definitely have a session talk to that person. The person must understand that he or she is here, and there are people that needs to be taken care by them. Because Tom is saying just a greeting, MEC. He didn't need anything more except that to say, how are you? Can I help you? Can you turn? I'm going to inject you now. Did you sleep well yesterday? Which the other doctors have been doing all the 14 days that he has been there. That's why I felt that you are right. We are doing it, but you are still not doing enough. There are still those people who think that I serve with a smile and care campaign must not be part of their package when they get into the hospital. But now, even at GCON, where we're training nurses and others, I said, because we've strengthened the skills development unit, there is a lady who is a director now, Samantha, that is running in every hospital, in every clinic with a pool, because we have now a pool, we're calling it, I serve with a smile movement, because every day there must be somewhere trying to make sure that things are correct in every institution where we are. And I know sometimes, I don't want to protect staff, because I was saying, I know sometimes there are specific areas where you find that we have not enough staff capacity, which we are busy now trying to employ more nurses and more porters where we have a shortage, and cleaners. Where we are going to be able to deal with those things, it's going to help us, because it's some of the things that we should do in terms of fully supporting our staff. Make it I say, it's my slogan now that says to them, make the Department of Health and Wellness an employer of first choice. So that whenever you think of the department, you must think of the department that you run to, even if tomorrow abantu bayaqosha emsebenzini or you want to leave. So we're changing that, and these are the campaigns that must help us in terms of the staff attitude. So I think in Ndabagatomi isizile, because it has showed us that there are other elements of the specific categories that we're not taking care of them when it comes to I Serve with a Smile and Care campaign.
MEC, I'm letting you go, and so allow me to abuse you for a moment. I know that we brought you here for a discussion on the healthcare facility, but you are the deputy chairperson of the ANC in the province. Tshwane has happened today. There is big worry that there is instability there. A simple question to you, MEC. Are you and the national office at the ANC, are you pulling in two different directions? Is your mandate different to that of the ANC at national level?
Our mandate is not different at all. We consult with the leadership of the national. Even yesterday, we had a meeting with the Secretary General of the ANC, with other comrades that he works with, like Comrade David Makura was part of that. Every decision that we take in the province, national is always involved. We brief them in any issue. They advise us. In fact, they are playing that advisory role in managing all the things that we're doing in the province. And we are happy, because I think we're happy because when we even ask on ourselves, we ask a meeting from them that there is this issue that we want to brief you on. They always give us that room.
So in short, MEC, so in short, MEC, I'm sorry to cut you off. So in short, you are saying that the removal of Silia Brink today has the express endorsement of the ANC at national?
Yes, national is aware. We've briefed them. They are aware of what's happening in Tshwane.
I'm talking about the endorsement. The word is endorsing. Do they agree with what has happened in Tshwane today?
I'm just saying to you, Koli, they are aware of what has happened in Tshwane. We briefed them yesterday.
We're going to have to leave it there. Thank you very much for your time. MEC Nomantu Nkomo.
Pulling my leg. Don't touch me too much.
Thank you very much for your time. Nomantu Nkomo-Ralehoko. She doubles up as the deputy chairperson of the ANC in Gauteng.